The LOTS LTC assessment means you can identify and assess patients very, very efficiently. The whole LTC approach shouldn't be held up with a complicated process and should be about providing helpful services to your patients. This process can be done in less than a minute and is designed to be done during your normal dispensing procedure. After selecting your patient, click into the LTC assessment. The first thing to note is the compliance score of the patient. If they are over 80%, then they are not eligible, but if under, they may be, so you can proceed. LOTS has a quantifiable calculation to assess compliance, which you can see here, but for this session we'll just accept it and move through the assessment. Select this box and the reason for the assessment. The second tab summarizes any long-term condition medicines and also highlights any LTC conditions a patient has. This step is automated but does require you to double check. There are situations where the use of a medicine, like amitrip, may be unclear, so use your professional judgment to be certain. You'll notice as we go through the assessment, the patient score is updated. Next, review any mental health conditions and any infectious disease conditions. Add the number of regular medicines and any hospital visits to complete the assessment. At this stage, you'll see whether the patient has scored more than 20 points or not. Press Save Form and you will update any LTCs to the patient file. The assessment will also be saved for future use, and a note will be entered into the patient comment file as a reminder to get their signature on their next visit. If the patient's there in store, print out the registration form, have a chat with them, and then they can sign it. You'll notice if the patient has not signed, there is an option ticked saying eligible, consent required. If the patient has signed the registration form, you can simply tick LTC and a start date and stop date is automatically added. Now you'll notice a Patient Forms and Files tab exists here. This tab contains any LTC assessment or any reassessment plans that have been completed, plus any management file plans that have been set. These are saved as a PDF file and can be viewed or emailed to a GP at any time. What we'll look at here is just how quickly and easily we can assess someone when we receive a script. From receiving the script, click into the manager and you'll quickly notice their compliance score. Seeing they're under 80%, proceed as normal, ticking the relevant steps, quickly checking their LTCs match their medicine history, adding how many regular items they're on, and then recording this. Once you exit out, notice that there's an assessment date and the score that the patient got. And of course their assessment is saved for next time the patient's in. Thank you, and hopefully that introduces you to the assessment tool in LOTS.